great pleasure, I would now like to introduce our guest speaker for this session, Professor Dr. Sandeep Kadu sir. Dr. Sandeep Kadu sir holds an impressive array of qualifications, including an M.B.B.S, M.D, F.M.J, L.L.B, M.B.A, and is currently a PhD scholar. His eminence is exemplified by his recognition as the recipient of the prestigious Best Teacher Medical Award from MUHS NASHIK for successfully completing 10 degrees. His commitment to academic excellence is further highlighted by his status as a FAIMER Fellow of the 2022 batch. In his role as the Controller of Examinations at the prestigious Maharashtra University of Health Sciences NASHIK, Sir has made history by successfully conducting the first ever online assessments for 3 crucial examinations and delivering results in a remarkable time frame of just 2 days. With over 22 years of teaching experience and a significant contribution as an author and editor of 10 scholarly books, Dr. Sandeep Kadu sir's innovative spirit has led to the acquisition of 3 patents, 4 copyrights, and an extensive portfolio of 46 scholarly publications. Sir's role in editing the esteemed work, Blueprints of M.B.B.S CBME Curriculum, has earned him acclaim in the field of education. His deep interest in medical research and medical education technology is evidenced by his role as a resource person for medical education technology and research methodology workshops at the MUHS NASHIK. Ladies and gentlemen, please join me in welcoming Professor Dr. Sandeep Kadu sir, who will grace us with his profound insights today on the topic CBME Curriculum of Forensic Medicine and its implementation.
Thank you. Good morning, all of you. At first, I apologize because I can't come yesterday, and I'm very thankful to respected Dean, Dr. Shailesh Moite sir, Organizing Chairman, Dr. Sukhdeve sir, Organizing Secretary, Dr. Sononi sir, for giving me this opportunity to deliver a session on most hated topic related to the medical education technology, but I'll try to make it as interesting. And my session will be the interactive session, so I'll also learn new things from you. Because here are the stalwarts of our forensic medicine, Dr. Sri Giriwal sir, Dr. M.B.B. sir, the Dean, Chauhan sir, Bardale sir. So all these stalwarts are there. So in front of them, I'm a very little person. We'll start. Next. So all we are witnessing the most important change in the medical curriculum. That is, we are shifting it from the traditional curriculum to the competency-based medical curriculum. The goal of the CBME curriculum is the outcome-based. Now, all over the world, the education system has these 2 important words. One is curriculum and another is the syllabus. So my question to budding professors, is these 2 words are same or are they different? Priyanka, what do you think? This curriculum and syllabus, these 2 words are same or is it different? Anybody volunteering? Kecha sir? Sir, please say. Yes, you are correct. So what is the basic difference between these 2 words?
Basic difference, I think syllabus includes only the academic this thing, and curriculum includes the sports, activity include केल्या ते आपण असू शकतो.
Yes, yes.
Pattern पण different असू शकतो.
Yes, H.A. sir has correctly said that the curriculum and syllabus are both the different words. Curriculum is the broad word, and the syllabus is a part of the curriculum. So curriculum consists of different parameters. What are these different parameters? First and foremost, that each curriculum has its different topics, and now in a CBME curriculum it is called as a competencies. Yes. So what is curriculum? Curriculum is a designed learning experience consisting of learning and assessment which facilitates the learner to achieve the prescribed outcome of the course. Again, these two words are synonymously used, program and the courses. Now my PhD guide, Dr. Mohan Pawar sir is there. He better knows that the course and program are these different words. Program is used, that the M.B.B.S is program, anatomy, physiology, forensic medicine are the courses. Am I right, sir? So these wording came as in a NAC. Actually we use it synonymously. So the curriculum has a broad aspect. It consists of statement of goals, course of content. Course of content is what correctly KH sir has said, that is the syllabus, then teaching learning methods, organizing and scheduling, and most important of each program is the assessment and the feedback from all stakeholders. So these all parameters consist of the curriculum, and syllabus is one of the parameters. Next thing is there is the phobia regarding now the CBME curriculum has came and what to do. But we should always remove that phobia, that we are the forensic medicine people or any other subject, we are going to teach our own subject only. So we are expert in our own subject. Then what is the difference? Difference are only these 5 to 6 parameters. Like previously we used to call as a topics, now we are calling it as a competencies. Course content, as I already said, that it is the same. That is the forensic people, or we are going to teach our subject only. Teaching learning methods. Previously in traditional curriculum, most emphasis was given on the large group teaching, means the lecture. Now they are insisting on a small group teaching, but all are know that due to the faculty constraint, all these things, it is very difficult to run the small group teaching. Then organization and scheduling, previously that we are not interacting with each other. Now in a CBME curriculum, they are insisting on the integrated teaching. That is, it may be horizontal or it may be vertical. Horizontal means if the anatomy people is teaching cardiovascular system, same way in a physiology that system will go, and in biochemistry what are the hormones or what are the things are enzymes related to the cardiovascular system that should be taught, that is the horizontal integrating, and in a vertical that for example injury we are teaching, then the surgery people also come and teach related to that is the vertical. So this in a CBME curriculum it is expected that all should teach that one topic under one roof. So and all topics cannot be, there are the in NMC guidelines, in FMT 10 to 12 topics are given which can be treated as a integrated teaching. Then assessment. There are two types of the assessment, formative assessment and the summative. Summative assessment that our university takes, that is the summative means the university exam or the prelim exam is the summative type of the assessment, and day-to-day assessment is called as the formative assessment. So there is one quote related to this assessment, that the testing of a soup by a cook is a formative assessment, and testing of a soup by a guest is a summative assessment. Means in a formative assessment, if there is some salt or these things, we can add or this one, or we can refine. But in a summative assessment, or that is by the guest, we cannot. So what is the aim of any curriculum is that that student must have that skills, that competencies, that it should be up to that mark. That is the main aim of any curriculum. So how it can be more or achieved is only by the formative assessment. If for example, in a postmortem exam, junior resident is there, if he has taken the incision, that incision is not proper. If there is some, this one, in that only, on the table only you can say, so that in next this one he can improve. That type of the day-to-day assessment is the formative assessment. In the CBME curriculum, the emphasis is given on a formative assessment. and feedback from all stakeholders. So it is the dynamic process. So whatever the feedback comes, we have to change according to that. So the basic is the curriculum, it is the broad aspect and consisting of these different parameters. So what the new in the CBME curriculum? You all know that there is foundation course because the students come from different areas. Also the language barriers are there. So this one, they get acclimatized to the new college, new program, new subject. This foundation course is really helpful. There are electives. In electives, so whatever if the student want to become a surgeon, he will attend the 1 month posting. Now previously in a CBME, this one it was for 2 months. Now they have reduced for the 1 month, 15 days. In that, if he thinks that he is fit for that specialty or not, according to that, he can take decision for his future career. Then integrated learning, I already explained. Then early clinical exposure. In early clinical exposure, that the first year student is also the part of the team of in a resident and the HOD. When they take around, the first year student also be a part of that team. He only watches how the HOD speaks, how this JR, SR takes the history, how the treatment is given. All this, his role is not in active treatment, but he is only observing all these things. That is early clinical exposure. Then more emphasis is given affective domain. You all know that there are many more cases of the negligence and as well as the quarrel between the doctor and the patient. According to me, it happens only due to the lack of the communication skill. There are other parameters also, but if we can handle that situation very diplomatically with a good communication skill, all these things can be avoided. So changes in the forensic medicine curriculum, you all know. Now our subject is we teach for the 2 years. That is the phase 2 and phase 3 part 1. 50 total 125 hours. In phase 2 50 hours, and in phase 3 part 1 is the 75 hours, and theory marks 100 marks, and the practical marks. Now then again the NMC has given new guidelines, and according to these guidelines, our practical examination again reduced from 100 marks to the 50 marks, and now all the subjects including anatomy, all subjects are now according to these 2023 guidelines, all subjects has been named or as a clinical subject. Then there is we have also done the revision in our journal format. So how next my topic given is how it is implemented. As you all know that the NNC and that board when this previously it was called as MCI, Dr. Avinash Supesar was the president of this one, and these people has really done a fantastic work how to implement all this CBME curriculum. They have made different committees. Most important committee at college level is the MEU department, at the Medical Education Technology department, and the curriculum committee. These two committees are very important to implement or to organize different workshops so that all the including tutor up to the HOD of that subject will get well oriented of a different concept what the CBME curriculum expects from the teachers as well as the student. So different workshops has been organized by the NMC. These are the first they train to the nodal center people, after that the regional center people, and at the college level that the curriculum committee and the MEU level. CSP 1, CSP 2, now CSP 3 is also going on. All these are organized from and all the resource material is provided by the NMC university level. So our MUHS is done very excellent job in implementation of this CBME curriculum. At that time, 4 years back, I was under the chairmanship of Dr. Shailesh Mohite sir. We have constituted a task force, and in that task force, in 2020, we have made all the timetable, the exam pattern, journal, all these things by under the chairmanship of the sir we have made, and it was accepted. Now it is going, but again the new guidelines has come in 2023, so we have to change only the practical scheme of the marks. So with these different levels like NMC level, university level, college level, and what I say personally, or I think personally, that each and every teacher should get motivated and give his or her 100% in the implementation. For that, he has to attend a different workshop, clear his or her concept, and then only it can be implemented. And what does CBME curriculum expect? Outcome-based learning that can be achieved only the active participation and the motivation of all the teachers. So I already told the task force has been constituted. In that, whatever different parameters are there, on that we have worked. Now, as I joined as a COE, and I'm very happy that the first time in India we created the blueprint book of all the 15 UG subjects. In that, what is the skeleton is there, 20 marks for the MCQs, then the remaining 40 marks, remaining 80 marks for the long answers and the short answers. But how much weightage should be given for each topic? In that task force, Dr. Ravindra Devkar, Dr. Wagmode sir, and we were there, and we prepared that provisionally how much weightage should be given to each topic. Then we have presented it to all the HODs, and taking up to their suggestions, we have refined it, and now it is very useful. And whenever the paper setter, paper moderator come to the university, I personally speak with all them and tell what is our concept, and according to that, you have to set your paper. And now also I have again taken one meeting 1 month back that this prelim paper should be set as per this blueprint guidelines, so that our FMT subject will be the first subject in Maharashtra which set the prelim as well as the university paper will according to the blueprint. So that is my vision, and it is only possible with your active participation. Though what are the challenges in implementing all logistic chaos? The 8 days back, one meeting was there of all Vice Chancellor, and MUHS sir has pointed out very important question that if that college has the capacity of only 200 students, they can accommodate, and directly the government gives the permission of 250. How these 250 students can be accommodated? How their practicals can be taken? All these logistic issues are there. So that we have to inertia. Anything, any new change is there, so resistance is there. So how to overcome the resistance? Resistance always overcome by effective communication skill, motivation of all the teachers, motivation of all the teachers, all the stakeholders. Lack of resources that can be handled with a proper with government agency, licensing with the government agency. Then faculty development and the motivation is very important. Again, it is only possible with that we always say that the charity starts from the home. So we have to come forward and clear our concept regarding the CBME curriculum. Then and then only it will get properly implemented. Otherwise, it will remain on the paper only. That in a practical exams we have put at least one should be as a OSPE. But I don't think that in a university exam still any OSPE station or that is used. It is on the paper only. But we have to try. There are the people whose knowledge is more than beyond the expectation. But we have to take a little effort to implement this OSPE and OSCE concept, establishment of the skill lab, as Devkar sir has already told that there are cadaveric lab in many colleges. So on that also the other things can be done. The standardization of the assessment method. These are the challenges related to the implementation of the CBME curriculum. So there is an existing favorable environment of the change, and we can easily implement the CBME curriculum. Most of the countries, institutes across the country are aware and need that CBME curriculum must be implemented. So there are many barriers, many challenges, but with the active participation of all with a good listening with the politician and the administration, we can easily implement that. So again, I'm very thankful. These are my references. Before ending my this, I want to show one video.
सर, तो आज सकाळीच विचारलेला होता ना की तुम्हाला काही पाहिजे असेल तर प्रयत्न केल्यावर जग तुम्हाला मिळवून देते. मला विचारायचं होतं की ते खरंच आहे का?
काय श्याम, हे मोठं लोक खोटं नाही बोलत. काही म्हणलं म्हणजे खरं असं तुला का माहिती
नाही सर, काय नाही.
तरी कुठं झालं का मला बोलू व्हायचं काय भाषा तू मनापासून प्रयत्न केला ना तुला पाहिजे ते नक्की भेटेल.
नको सर.
लगा तुला नाही रे छापा भेटायला. बोल तुला काय पाहिजे.
छापा.
ओळख की बोल काय.
सर, काटा आहे.
येऊ दे की परत कर. काय आलं
सर, काटा आला.
मग येऊ दे की परत ओढव. आता काय
सर, काटाच आला.
येऊ दे की परत कर.
सर, छापा आला.
आला ना पहिल्या कामाला नसा आला पण तू प्रयत्न केला नसेल हारला असाल म्हणून माणसाने नेहमी प्रयत्न करा.
So we'll try, and we'll definitely implement this CBMA curriculum. Thank you very much for giving me the opportunity.
There is no difference in much faculty, but CBMA curriculum require more background teaching and more assessment for medicine. How to overcome the challenge?
No. I will answer your question. For the 200 also, one professor, one AP, one lecturer, 3. And how many tutors or SRs are there? 9. किती आहेत? 4. किती झाले आपले? 7. 8 staff. 200 if the way this one. If we made 25, किती होतात ते लोक? 8 जणांमध्ये करायचं. HOD नी पण काम करायचं. That is expected. So we can easily take the small group teaching.
Sandeep, I beg to refer, actually question asked by Dr. Shailesh in conference was, it relates to forensic. Staff will be busy in autopsy, some will be attending court, some will be going to crime scene.
Yes.
In that case, SGT will be practically difficult.
Yes.
And I agree there are 8 people, but tutors as per NMC requirement, half the tutors are interested in appearing for NEET. So how passionately they will do, forget forensic, even for anatomy and other subjects they have increased tutors. So how passionately they will teach SGT is always questionable. I am not questioning your intentions.
Yes.
Your intentions are good, but these are practical possibilities which were questioned by Dr. Shailesh to NMC. If I am right, Dr. Shailesh. So
Yes.
it's not resistance from his side. He was asking practical questions. So we will only have to overcome it. Maybe distribute the batch between patho, micro, pharmac, and then come down to a 30 people.
Yes.
One more question from my side. If you have read a MSR recently,
With the permission of chair.
let me complete, sir. Wait. Sorry, Dr. Ambat, let me complete. They have said now AdCom question compulsory in both papers, which is actually easier for student because number of AdComs, actually it's advantage for a student. There are hardly 3 or 4 AdComs per subject. So that question has to be from that AdCom only. What is your take on it? They are saying that in each paper now there should be AdCom instead of only one paper.
Now what happens in NMC also? They are changing rules within 4 days. That should not be also happen. But what we can do? But as I have, MUHS is the first university with all the taking deliberate discussion with Honorable Vice Chancellor Madam, and we have not accepted the assessment pattern. We are going for this batch. They told that whatever the examination is coming after this 1st September, that should be according to 40-60 passing. But we have not accepted, we have given written a letter to the NMC. It is not possible. We can implement from this new batch, but retrospectively we cannot. So we all have to take an active this one, write a letter to the NMC, what are the difficulties, how we, then and then only it can happen, sir.
Sir.
Hello. Is there any provision, Sandeep? Suppose one student is not achieving that competency as per the CBME, and repeatedly we are trying to upgrade that student. We are giving multiple chances, even if that student is not achieving that competency as per the CBME. So, what is the role of MUHS in such a situation?
MUHS only we only take the examination as per the rules and guidelines given by the NMC. So we at the university level we cannot change that.
Sir,
And the passing criteria they have clearly mentioned as
Dr.
per
Sandeep,
the.
you want to ask something?
sir, actually ground realities are very different.
Yes, sir.
At Miraj and Solapur, Dr. Rajesh Bardale is only professor, no staff at all. People don't want to join as a tutor in forensic medicine department because there is extra work of doing postmortem and then court cases and all other
Yes,
things.
yes.
So
How
nowadays
MUHS is involved in this?
situation is so bad.
That is the employer, we should ask the employer.
We are struggling to get people to do routine autopsy. Teaching is beyond secondary thing nowadays. मेरी उम्मीद MUHS से इतनी है कि now we have people sitting over there in MUHS. उन्होंने for forensic subject consent of affiliation ही देना बंद कर देना चाहिए UG के लिए. अगर forensic का faculty नहीं है, you will not get consent of affiliation. Then and only then. Second thing I want to add कि MUHS ने तो minimum रखा है 1 we know इतने में नहीं होता. तो MUHS would come up with कि महाराष्ट्र में in a progressive state like Maharashtra we want 2 professors, 4 AP and 4 lecturers in forensic medicine subject. तो ये अभी forensic के हमारे लोग बैठे हैं तो ही possible है, otherwise तो ये distant dream है. दिल्ली तो ठोक चुका है, at least महाराष्ट्र में तो भी ये possible हो पाएगा I think so.
Mishram sir, well taken. We are with a discussion with Honorable Vice Chancellor Madam.
No.
I definitely give, because our registrar sir is there, we will again write a letter to the NMC regarding this. But deliberate discussion was done as per what you say, LIC and all these things. For example, if we remove the affiliation of nursing college only now, still these people go to the court and from the court they again this one. So we become helpless.
Hello, Sandeep. You are all stalwart are sitting in MUHS. I request you to make paper 1 and paper 2 of forensic medicine of 100 mark. So we are done at AIMS also. We have divided that subject in paper 1 and paper 2 like pathology, microbiology and forensic and pharmacology. So in paper 2, so is there any provision to make it paper 1 and paper 2?
Because again I am saying that we have to follow guidelines of the NMC. NMC में उसका paper 1 ही है.
एम्स में हमने कर दिया सर.
Because you are autonomous, so you can do that.
No, but what we can do, Kadu sir, in this we can take representation from the head of the departments, and MUHS being the competent authority can put forth to NMC.
Yes sir, I already told.
Because when it is going from MUHS,
yes,
the impact would be better than independent institution sending any changes to the NMC. So if this can be done through Honorable VC Registrar or your office, at least if we get paper 1 and paper 2 like in AIMS, our subject would be automatically upgraded at par with pathology and all other subjects.
Yes.
So I request you will send a requirement, and if required in Senate meeting, I will raise this issue.
Yes, yes.
You can raise it as 0, I will do that.
Yes.
And thank you. I think, एक मिनिट.
Yes sir, ना sir.
SR तर कोणीच नाही आहे सर आता सध्या तरी.
नाही पण
म्हणजे हाऊ टू क्रिएट द SR विदाउट द पोस्ट ग्रॅज्युएशन. That is the question.
Sir, sorry.
One question, chairperson,
Yes,
sitting in the center. Since I take the opportunity, since Dr. Kadu is over here, there are various workshops for teachers to attend, CISP, CBME, etc. We conduct classes, practicals for students. Is there any monitoring system at our university or any other universities? Do they have any monitoring system? Whether students are attending, not attending, whether teachers are taking lectures, not taking. Recently, NMC has told us to fit in 25 cameras in lecture halls, OPDs, etc. But I really doubt, are these cameras anywhere monitored? Because I have not come across any college who has got a warning that your classes are seen empty, no one is attending. So I think at university level, since you, Dr. Bangal, are at Hem of Affairs at the university, should take some steps so that students attend, if any modifications have to be brought. Because nowadays what has happened, it is become more of a torture for teachers to attend so many workshops, do work, compared to the decrease in faculty. I think university should take some stand on this. Thank you.
Yes, yes, definitely. But only I take
I think-
1 minute, because under MUHS, 536 colleges are there, and it is humanly not possible to monitor how many students are attending and all these things. So we have given all this responsibility to the respective dean. So dean is our approved, MUHS approved authority, or this one. And our Vice Chancellor Madam always says that we are not going to policing everybody. And yes, and we are dealing with the patient. All this should be come from the students as well as from the teachers with from the inner heart that it's our duty to take the lecture. It's from the students. It's our duty to have the 80% of this attendance. Then and then only. Policing cannot have any authority. It's not possible to monitor each and everything. Everyone has to take his or her initiative.
Yes, I agreed. COE, sir.
2 or 3 colleges also.
Sir.
2 or 3 colleges pick up randomly.
Sir.
Take action.
Sir.
Other colleges will automatically improve.
Okay. Sir.
Yes, yes. Thank you, Kadu sir. Undoubtedly, as I said in yesterday's, we had appreciation for you.
Yes.
But for some reasons, you were busy yesterday.
Paper was
And
there.
we really feel proud the forensic community, along with Dr. Bangal sir, yourself, previous KD sir was there. And in your era, we mentioned yesterday on the platform from my side that your blueprint is really a helpful guide to all of us, and we will see that by and large we all will try to follow from this year prelim exam itself.
Thank you.
And just like what you did, online examination success, and same I think last Senate,
Yes.
I have taken on the platform of the MUHS trustees that you was the only one COE to see that the online examination is done within stipulated time or 2 days before the time which was scheduled by MUHS. So thank you very much for your insight in this topic and best wishes.
Thank you, sir. Thank you, all of you.
Thank you so much, sir, for such an enlightening and valuable session. I request our respected chairpersons to kindly felicitate Professor Dr. Sandeep Kadu, sir, with a token of appreciation.
Madam.
I would now like to invite Dr. Mohan Pawar sir, Professor and Head of Forensic Medicine Department at Dr. Balasaheb B.K. Patil Rural Medical College at Loni, Ahmednagar. I request Dr. Mohan Pawar sir to kindly felicitate our esteemed panel of